I think what one needs to understand is that anxiety disorders are quite common. More than 200 million people in the world suffer from some kind of an anxiety disorder or the other. And before I get into these signs and symptoms, I want you to understand that anxiety disorders essentially happen because of multiple factors, biochemical changes, certain neurotransmitters that go up and down, our personality factors, the social factors, our interface, and our approach. All of these things put together tend to influence whether we get an anxiety disorder or not. Now, before you get into realizing whether you could be having it or not, you also need to understand that to call a disorder, we need to understand that there will be impairment of functioning. So what it means is, if I'm having a problem, it will affect either my social functioning, my personal functioning, my occupational or academic functioning. That's when it actually becomes a disorder. So how would I know that I'm more anxious than what I should be? If I am over preoccupied, if I tend to think a lot more, if I'm struggling to relax, unwind, even when I want to relax, there's something on the back of my mind which keeps on bothering me. If I'm avoiding certain situations because I feel low confident about it, or I feel hesitant, or I may feel that I start having some anxiety feelings. For example, some people talk in terms of experiencing palpitation, some people experience a bit of breathlessness, giddiness, headaches, it may be having sleep impairment. And so what all of this does is that it starts impairing your functions. So if you feel that you started feeling more anxious, you tend to worry a lot more, your mind is thinking a lot more, you have these physical signs of distress, restlessness, anxiety. And yes, if you're also having impairment of functioning, you could be having an anxiety disorders. Generalized anxiety disorder, phobic disorder, panic disorder are some of the more common anxiety disorders that are seen in people. Medications and psychotherapy, counseling are very effective. Social support helps. And the essential component here is that if you identify it quick enough and do the right kind of intervention, more often than not, you'll be out of it very soon. So on this World Health Day, I suggest that all of you take care of your mental health. If you have distress happening, don't hesitate to talk, unmute yourself, reach out to somebody.